What is a threatened miscarriage? A threatened miscarriage, threatened abortion, describes a pregnancy that could possibly end in miscarriage due to mild vaginal bleeding with or without abdominal pain or cramping. The bleeding tends to stay light and cramping remains mild, sometimes lasting several days or weeks. Threatened miscarriages occur in the first half up to 20 weeks of pregnancy, but most commonly in the first trimester 13 weeks of pregnancy. Many pregnant people experience vaginal bleeding or mild cramping during pregnancy. This doesn't mean that there's a problem with the pregnancy or that miscarriage will happen. In many cases, you'll go on to have a healthy pregnancy. These symptoms mainly tell your provider that further monitoring may be necessary. Contact your pregnancy care provider if you have vaginal bleeding, abdominal pain, or cramping. What causes a threatened miscarriage? There isn't one cause of a threatened miscarriage. Some factors that play a role in a person experiencing a miscarriage include chromosomal problems with the fetus previously having a miscarriage, alcohol or drug use or exposure to chemicals early in the pregnancy, having obesity, being older than 40 during pregnancy, smoking cigarettes or vaping, problems with the placenta, trauma or injury, vaginal or uterine infections. How long does a threatened miscarriage last? A threatened miscarriage can last several days or several weeks. The exact timing and symptoms vary from person to person. Do HCG levels drop with threatened miscarriage? Sometimes. HCG, human chorionic gonadotropin, is known as the pregnancy hormone. HCG increases steadily until about 11 weeks of pregnancy, sometimes doubling every few days. In general, if HCG levels decline over several days prior to 11 weeks, a miscarriage is likely. But in the case of a threatened miscarriage, a person's HCG levels may remain steady. If your HCG levels are low, your provider will recheck your levels every 2 to 3 days. It's important to note that in healthy pregnancies, HCG levels drop after about 11 weeks. Please consult your healthcare provider to interpret your HCG levels.